All right, we're going to do our CAM assessments, our DFAMATs and PICS for Unit 7 muscles. So for the CAM assessment, again, we're going to do an active assessment bilaterally. I'll do throughout the whole box. I'll just do her, let's do right side to start with. So I'll have her actively internally rotate at neutral. Again, I'll do that bilaterally. I'll have her externally rotate at neutral, actively. Abduct with internal rotation, abduct with external rotation. Again, both sides. Hip flexion, active internal rotation, active external rotation. 30 degrees in the sagittal plane, internal rotation, external rotation, coupled with adduction with hip flexion with both internal and external rotation. Also, we do bilaterally active external rotation, active internal rotation, and for this particular muscle group, for sure, we're going to do the figure 4, actively bring your knee to the table. Okay, and again, we're going to assess all of that bilaterally in prone, so go to your stomach. We're definitely going to be checking active external rotation and active internal rotation. Good. With iliacus too, another CAM would be slightly abducted. We're going to lift your leg, Sarah, off the table. Lift and check her active motion into hip extension. Good. So let's go back to your back. We'll start with iliacus. So with iliacus, we're going to be hip flexed 30 degrees actively, so hold that there. We're also going to externally rotate at 30 degrees. And then we're going to hold. So hold right there. Hold. Good. Okay. So we're going to compare that bilaterally. So hip flexion, external rotation, and then hold. Good. So for our DFAMAT with iliacus, we're going to come off ASIS off to the crest of the hip and down off those iliacus fibers. With the knee flexed, we're going to come off the lesser trochanter, so from the greater trochanter, come down forward into the femoral triangle and palpate lesser tuberosity. Okay, and then retest. So hip flexed, externally rotate, and hold. So we treat the side of weakness there. For our PICS with iliacus, what we'll do, we're gonna have you hold here, externally rotate 30 degrees. Now relax, Sarah. Okay, now just lift up and hold. 6 seconds. And relax. And we repeat that 6 times for the iliacus. For rectus femoris, there's 2 protocols for the rectus femoris. First, we're going to have hip neutral, raise the hip in the sagittal plane to 30 degrees actively. We're going to hold right there. Hold. Okay. Then we're going to do the reflected head. So active hip flexion with internal rotation. And hold. Good. So for the DFAMAT for rectus femoris, we're coming off ASIS down medially and inferiorly to the AIIS. Then we're going to come down off the quad tendon, superior pole of the patella, and then infrapatellar tendon. We could retest there. Hold. Look for any compensation. Relax. We can do our PICS in that position. So relax. Okay, you're gonna hold. Now hold. Gentle resistance. 6 seconds. Times 6 contractions. That's for the first protocol. The reflected head, the short head. Again, we're gonna flex hold internal rotation, hold down. For the DFAMATs there, we're going to go off the anterior slip of the acetabulum, so final grade of trochanter, come across, in off that anterior slip, which will be inferiorly and a little bit medial than the AIIS. Again, coming down off quad tendon and infrapatellar tendon down to the tibial tuberosity. Retest, hold, push, good. And then you can do your PICS, again, internally rotated, hip flexion to 30, meet that resistance, hold for 6 seconds, and then relax. So then moving to the TFL, TFL is a hip flexor, slight hip abduction, so we're gonna go abduction to 20 degrees, hip flexion to 30 degrees. First protocol is we're gonna go straight down. Hold that right there, Sarah. Straight down, hold. Okay. The second protocol would be hip abduction 20, hip flexion to 30, internally rotate, and then pressure is gonna be down and medial. Hold. Okay. If you assess weakness in either one of those two, you can do the anterior fibers, which and then the posterior fibers. So depending on which position was weak, so we come off ASIS, crest of the ilium, anterior fibers. Then we're going to come down to the IT band, just past the Dritter trochanter, work there. Lateral femoral condyle, laterally. Find the fibular head, move anterior, bisect over Gertie's tubercle, and retreat the anterior fibers. Hold right there. We're at abduct, hip flex, push. So you can do your PICS there. Hold that lift up gently, 6 seconds. Repeat 6 times. For the posterior lateral fibers, internally rotate, hold right there, pressure into my hand down immediately. 6 seconds, repeat 6 times. Okay, good. Moving into sartorius, the test position for sartorius, again, we're always going to do a comparative study, find out where we're weak, but we're going to externally rotate, abduct, and hip flex. Relax here a second. And then the motion here, Sarah, I want you just to maintain that, and I want you to, don't let me move you off that spot. Hold. Hold. Again, do a comparative study there. For the DFAMAT, we're going ASIS. That's right. And working that proximal insert origin of sartorius, ASIS. And then coming down off pes anserine, the most superficial of the pes anserine tissues. Put her in the figure 4 position again. Retest. Hold. Okay. For our PICS with sartorius, relax. I just want you to, we can take her off here too if she's a little flexed, or leave her here. But I just want you to meet my resistance here. Relax. So relax here, Sarah. Okay. Now pull into my hand. Good. And hold for 6 seconds. And we're going to repeat that with the PICS 6 times for 6 seconds. Okay. For piriformis, we're going to flip her prone. So go to your stomach. So for piriformis, slight abduction, we're going to have her actively externally rotate. And then, Sarah, I'm just going to pull you this direction. I want you to meet that resistance. Hold. She's hiking her hip a little bit, so a little weak here. Hold. So she's weak there. Again, comparative look. For our DFAMATs with piriformis, we're coming off the ILA of the sacrum and going into the flesh of the glutes, so falling off the cliff there, halfway between the coccyx and the PSIS. Then greater trochanter, we're going the superior aspect slightly posterior and working piriformis there. Retest, hold. Okay. And then for your PICS, what I want Sarah to do, just push gently into my hand, 10% contraction, 6 seconds, and we're gonna repeat 6 of those. Okay, relax. Let's go to your back. So the next external rotator we could look at is quadratus femoris. So we are going to assess her hip range of motion. There's 90 degrees. We're going to drop down to 75 degrees. Hip flexion, external rotation. Sarah, keep that position right there. Don't let me move your foot. Hold. And hold. Good. And so we're gonna check there. For quadratus femoris, for the DFAMATs, we're gonna have to put her prone again. So let's go back to your stomach. So, pardon the reach here, Sarah. We're going ischial tuberosity here. So we're gonna go lateral to that and deep for the quadratus femoris as it comes out laterally just off the ischial tuberosity. And then we're finding greater trochanter in that bottom portion. We're gonna scrub off that lower aspect of the greater trochanter there. Okay, go back to your stomach. Retest, go from 90 degrees back to 75, externally rotate. Hold right there, Sarah, hold. Retest for strength. For our PICS, I'm gonna have her maintain that 75 degrees, hold right there. You're just gonna meet my resistance here, hold for 6 seconds. Repeat 6 times, okay? Another external rotator, obturator externus. The last one was similar to the quadratus femoris. We're gonna go from 75 past 90 to 110 degrees of knee flexion. Externally rotate, hold right there, Sarah. Hold, test. Again, compare both sides. Find where there's weakness. For our DFAMAT, we're gonna put her back in prone. Similar to the quadratus femoris, we've got to find the obturator foramina. So that's in the front, it sets in the front of the pelvis, but we come off ischial tuberosity. Again, coming out laterally where we would sort of for quadratus femoris and kind of wrapping around deep into that area for obturator externus, and then going up into the neck or over the slip of the greater trochanter deep to it and over that superior aspect for the other insertion point. Then we'll go back to your supine position. We're gonna flex the hip to 110, externally rotate, retest, hold, good. And then for our PICS, we'll maintain that 110 flexion, external rotation, hold right there, and then just meet my resistance, push into there, and relax. Pull, there you go. 6 seconds, 10% contraction for 6 reps. That's good.